It was in the month of November during my first year winter vacations where I was confused. I was standing at crossroads. I did not know which path to take until I met this guy. This is Azaz Anwarkazi and he's my senior. And after a series of events, I got this in my second year. Hi, my name is Mohammad Hassan Kareem and I'm currently a second year MBBS student at Bolan Medical College, Quetta, Pakistan, and this is how I passed USMLE Step 1 in my second year MBBS. In this video, I'm going to show you what resources I used, what my study schedule looked like, and how you can also get the pass come test day. So this video is for anyone who is in their first, second, or third year of med school, or anyone who is serious about taking the USMLE Step 1. First, my timeline. I started studying for Step 1 during my first year winter vacations. And a lot of people ask me, why did you start this early? Well, I had a couple of reasons. Number one, I was already mentally prepared from my first year that I want to give the USMLE exams. Number two, I really wasn't satisfied with the way that I was learning medicine. I wanted a stronger focus on understanding the clinical concepts rather than just memorizing isolated facts. Number three, we had to study long resources and textbooks to understand just a simple little concept. By the way, no Guyton was heard during the making of this. Now, don't get me wrong. A lot of people love these resources and they usually recommend them. But for me, it was very difficult. I just have a really short attention span, like maximum of 20 minutes, and that's it. That's why I couldn't bear these books or resources. And that is exactly why I shifted towards USMLE, where your understanding and grip on concepts was rewarded. Memorization is still an important part of it, yes, but at least you memorized important clinical knowledge rather than just memorizing bony features. So now for my study schedule, I used to study 8 hours every single day in the library covering the systems. But my senior, Azaz, told me to go easy on it. The reason being to avoid burnout at the end. And so I cut it down to 3 hours, but every single day. Now, this really helped me. The reason being because now I was able to enjoy med school with my friends and I was also able to study every single day. Now for the resources. So these resources that I'm going to tell you are going to be for people who are just starting their preparation for Step 1. First off, your foundational sciences and your system studies. The first thing that you have to do is start with first aid and supplement that with boards and beyond or boot camp. Now, first aid is not, and I repeat, is not a textbook, right? So if you don't have a baseline knowledge, you cannot study from it directly. So what you need to do is that you supplement it with either boards and beyond or boot camp to fill in those gaps. Now, which is better, boards and beyond or boot camp? Honestly, it's just down to personal preference and they are not superior to each other. So just open first aid and look at the topic that you're going to be studying today and open the lecture on boards and beyond or boot camp side by side and just focus on learning the concepts. Next, for pathology, Pathoma. You knew this was coming. This is a book and lecture series created by Dr. Hussain Sattar and I believe it's the best concise resource for pathology out there. All you have to do is just open the chapter and open the lecture. And all you have to do is just listen to what he is trying to explain. He explains difficult concepts in a very simple and easy manner. So all you have to do is just focus on listening in. For microbiology, Sketchy. There is no other option. Sketchy is the best resource for microbiology because it's such a memory heavy subject. And I do not recommend any other textbook or anything. Just use Sketchy and memorize all of the sketches and the bugs, and that's literally it. Similar to Sketchy, use Pixarize for biochemistry. It is really helpful in remembering the memory heavy stuff such as lysosomal storage disorders and glycogen storage disorders. For biostats, I went with Dr. Randy Neal's Biostat playlist. It's one of the best resources for biostats out there, and me personally, I was really weak in biostats, right? But after watching his playlist, I started understanding the basics and was able to apply them in questions and get them right. For pharmacology, study it from first aid and boards and beyond. But from some specific classes of drugs, such as antimicrobials, antiarrhythmics, and autonomic drugs, you can do them from sketchy pharma because sometimes these drugs can be really overwhelming. As far as ethics and behavioral sciences is concerned, I just learned that from doing Qbank questions, and that's it. And just one tip that I can give you when answering these questions, all you have to do is choose the answer which is more patient-centered and respects the patient's autonomy. Now finally, Qbanks. There are only two that I would recommend, Uword or Amboss. But if I had to prefer one, it has to be Uword. Do Amboss only if you have a lot of time on your hands. Now, Uword is a learning tool. It is meant for active recall. So whenever you're doing a question and you get a question right or wrong, always read all of the explanation and choices deeply and understand the concept that is being taught. Normally, you should do 40 questions on tutor mode and you should learn all of the different concepts that are being tested. Next are Livestream PDF and YouTube Qbank. Many people have this misconception that if you do them, they will falsely inflate your scores, but I think that's just false. Why? Because you are learning those concepts and you are applying them in questions rather than just memorizing them. One very high yield resource is the High Yield Arrows Anki deck. I highly suggest that you do that at the least. It really helped me with understanding physiology and pathophysiology, and it really boosted my points. Finally, NBMEs and Free 120. NBMEs are kind of like your mock exams. They consist of 200 questions and are numbered from 26 to 33. Now, these are your assessment tools. This is where you find out how much prepared you are for step 1. Now, normally the criteria that I want you to keep in your mind for step 1 should be 70% or greater in 3 NBMEs at the least. Now, there are people who have scored lower than that and still passed. But obviously, since the stakes are so high in this exam that you cannot take that risk. So that's why you should keep a very good cushion, right? So around 70% should be a really, really good margin that you should have on test day. Now, my average was around 85% in the NBMEs, but still on the exam day, I still felt very confused and the questions did feel difficult. But like I said before, it's all about keeping the cushion. Now, I get this question asked a lot. What was the exam most similar to? And I have two answers. Think of it as NBME 33 on steroids, or it was most similar to Free 120s. So the best advice that I can give you is that give the Free 120 at least 3 days before the exam and complete all of your NBMEs and review them deeply and check which concept is being tested in which question and whether you got it right or wrong. Also, I highly recommend that you review the Free 120 and the latest NBME the night before the test. And this is something that I did personally and it really helped me. The reason being because you want to get yourself familiar with the question writing style as much as possible. Because on the test day, the questions will seem very weird, they will seem very vague, but at least you know the concept and you will not just freak out, right? Because you are familiar with the question writing style. Now for my final tips and advice. Be consistent. I cannot stress how important this is. Be consistent, study every single day. It doesn't matter how much you study every single day, just be consistent, right? So like me, I was first studying at 8 hours, but then I reduced it to 3 hours, but still the pattern was same every single day, right? So stay consistent. Next advice, during your study periods, remove all of your distractions. Study in a quiet place where you cannot be disturbed, and please, please, for the love of God, do not use your mobile phone during your study periods. Lock it off, throw it away, and just don't pick it up. Okay, it's one of the most biggest distractions during study, and just make sure that you do not get disturbed by it when you're studying. Finally, don't chase perfectionism. The sooner you accept that you are going to get questions wrong on the Qbanks and maybe on step 1, the better it is. Because there is too much to learn and too much to forget. So just focus on doing your best, and that's all. So just focus on what's important, and the rest of the pieces of the puzzle will fall in their place eventually. Lastly, during my preparation, I wrote a book called Pathologic. It contains immunology and general pathology. The lectures are available on the YouTube channel with supplemented. I tried my best on writing down all of the high yield points that I learned during my preparation, and the best part is it's completely free. You can find the link down in the description of this video, and you can also find it on my Instagram bio and also on the description of all of my lectures that are available on my YouTube channel. So if someone from a government medical college in Pakistan can do it, I know that you absolutely can. So guys, if you enjoyed this video, make sure to like, subscribe, and comment for feedback, and share it with someone who is preparing for step 1. Help this channel grow. It would really mean a lot to me, and I would really appreciate it. I will be uploading more step 1 related content, and that's all for now. Thank you. Allah Hafiz.